down to the past medical history, or cái lịch sử trước khi cái bệnh này xảy ra. So the history before the present illness occurred is the past medical history. Cái lịch sử trước khi cái bệnh này xảy ra. For the past medical history, you ask them if they have a medical problem like heart. Heart is tim. Any heart disease is có bị bệnh tim không? Bị bệnh tim không? Any lung problem, phổi. Lung is phổi. Any liver problem, liver is gan. Any kidney problem, kidney is thận. Có bị bệnh any diabetes. Diabetes in Vietnamese is bệnh tiểu đường. Any high blood pressure. High blood pressure in Vietnamese is cao huyết áp. Có thiếu máu, anemia. Any anemia, that's thiếu máu. And then lastly, any cancer, and cancer is ung thư in Vietnamese. After the past medical history, you want to know the past surgical history. Past surgical history is lịch sử giải phẫu trước khi bắt đầu bị bệnh này. So the past surgical history is lịch sử giải phẫu trước khi bệnh này. Next, you would ask about the allergy to medication. Allergy is dị ứng. Có bị dị ứng gì với lại thuốc không? Which means you have any allergies to medication. Next would be ask them to list the medication they're taking right now. Medication is thuốc. Taking là uống. Drink. Uống thuốc gì bây giờ không? Nghĩa là do you take any medicine at this time? The social history, you will ask about smoking, alcohol, and drugs. Smoking is hút thuốc lá. Alcohol is uống rượu. Và drugs là thuốc phiện. And then next step would be to ask about the family history, or lịch sử của gia đình, lịch sử bệnh của gia đình. That would be the family medical history. And obviously you ask the same thing you ask when you ask about the past medical history of the patient, which is any diabetes, any high blood pressure, any heart disease, and so on. And the last, and I think probably important, very important, is the review of system. See whether there's anything that you have not asked or the patient have not mentioned to you, and that is important. So you go from the top down to the bottom, head to toe, review the system, head, eyes, ear, nose, throat, neck, chest, and so on. So some of the things I usually ask for the review of system is following, do they wear any glasses? Because if I do eyelid surgery, glasses is mắt kính. Do they have dry eye? Khô mắt. If I'm planning to do breast surgery on the patient, as part of the review system, I ask them if they have breast disease. Có bị cục u vú không? If they ever had a mammogram done. Mammogram is a quang tuyến vú. And then I ask whether they've ever breastfed their children, and breastfed is bú sữa mẹ. So that's a quick rundown of the history and physical, the history portion of the history of physical exam. I tried to go over some Vietnamese words for the American English words, but probably not as detailed or comprehensive as you like. If you want, you can click on the link next to the screen, and we'll let you see the PDF file that will give you a more detailed translation between the English and the Vietnamese for the history and physical examination. Thank you.